think the most common things we see are going to be, say, fibromyalgia, osteoarthritis, rheumatoid arthritis, systemic lupus, and then as we get into our older patients, gout becomes more of a problem, and that's kind of the main thing we see. Because all of these conditions are musculoskeletal in nature, we end up seeing a whole host of common musculoskeletal conditions as well. So common overuse injuries, tendinitis, problems of that nature. There have been several studies recently that draw from administrative databases looking at the incidence of osteoarthritis, and it appears that there is an increased risk of osteoarthritis in our active duty and veteran populations. And this seems to exceed that of the civilian population. It's important to stress that we don't know why, although we can speculate that soldiers, sailors, airmen, and Marines have to do more repetitive activity, more heavy lifting, and things that we know are associated with osteoarthritis. We also know that joint trauma of any kind has a strong association with osteoarthritis, and this is a population of people that is going to be at risk for joint trauma. In general, women have more rheumatic disease than men. So if we look at, say, autoimmune connective tissue diseases, women are much more likely to get these conditions. And so in that sense, you would expect that would be the case, at least when it comes to the less common autoimmune diseases. With osteoarthritis, again, a recent trial found that women are more likely to get osteoarthritis as well. And I think that between those two things, that may be a reason. The study you're referring to, I believe, out of MMWR, asked these patients a question whether they had any history of rheumatoid arthritis, fibromyalgia, or any arthritis, encompassing a pretty broad spectrum of conditions. And that includes the things that we see more commonly in females. So I think that to answer your question directly is, yes, we should have a higher index of suspicion for these conditions in women. I think that the main challenge is related to answering the question, does this patient have an arthritis of this nature or not? And that takes time and it takes manpower. So with increased people with increased veterans with these sorts of injuries, these questions are coming up more often, and we're consequently being asked our opinion more often as well. I think in terms of the diagnosis and management, it's all very similar. There is nuance to the management, particularly of the autoimmune conditions, because the drugs we use, while they can make, say in the case of rheumatoid arthritis, they can dramatically improve the symptoms that a patient has so that they may be able to go back to their job. In the military, many times that job may be traveling overseas and going to areas where monitoring the side effects of those medications presents a real problem, or where the environment that they may be asked to go into is really incompatible with the medications that they're on. And in that sense, we manage these conditions in a little bit different way.